Welcome to another episode of the Bandage Podcast, a weekly wrap-up of the most trending healthcare news. Each week, we'll discuss the latest in healthcare, health IT, and compliance.
In this week's episode, we discuss how soil affects heart health, new laws for New Jersey health insurance, and 2022's National Fitness Index. Let's wrap things up. This is episode 144 for the week of July 18th. I'm Matt Moneypenny.
And I'm Albert Battistelli.
Before we get started, our diagnosis code for this week is Y93.G1 or activity dishwashing. I did not know that this existed. But this has made my life.
Yeah.
So,
dishwashing. Activity dishwashing. Ouch.
Yeah, it's freaking baller, dude. That's baller. I mean, I kind of want to go. This is like a bucket list billing code. Diagnosis code. Like, I would like to go to the doctor for something related to dishwashing.
Yep.
And then this land in my medical record at some point.
Right. Like, I sprained my wrist, or I got sliced by a knife that I didn't see at the bottom of the
It's sink. It's a vanity. This is like a vanity dishwasher medical code. Like, you can go on social media and be like, look what I got.
Look at my Y93.G1.
This is sweet. It's a status symbol.
It is. You get it tattooed on you.
Yeah, I'm a badass. I went to the doctor for dishwashing, man.
Right?
I'm tough. I'm tough as nails.
Tough as nails.
Anyways, that's enough about dishwashing.
It's really great.
First up, we've got what?
I said, if you've had one, right into the show, let us know. We want to know.
Yes, right into the show. First up for this news is dirt to heart disease. Whoa. Recent research has made it clear that pollution has negatively affected the air and water we depend on. The newly published research focuses specifically on the link between pollutants in our soil and an increased risk in cardiovascular disease. Soil is the foundation of the agri-food system and the medium in which nearly all food-producing crops grow. About 95% of the food we eat comes from the soil. Not just any soil, the soil. The main threats to the human health in soil are macro and microplastic deforestation, pesticides, over-fertilization, and heavy metals. Metals, such as the band Metallica, just kidding.
Right.
Metalloids and pesticides may produce oxidative stress, which is recognized as a trigger for a range of non-communicable diseases. Metals such as cadmium and lead, in addition to metalloids such as arsenic, are linked to cardiovascular disease. Whoa. We got metals, we got plastic, we got deforestation, we got pesticides, we got over-fertilization, and we've got heavy metals.
Yeah, it's all bad. Lots of bad things.
I didn't know over-fertilization was really that big of a deal.
Yeah, no, I didn't know that either. I thought you couldn't do that, but I didn't know that you could do too much fertilizer.
Yeah.
But I guess you can. Now, is it talking about natural fertilizer, like poop, or is it talking more about Roundup or those kind? Not Roundup.
Roundup is a pesticide.
That's a pesticide. Is it one of those? What's it called?
You're talking about Miracle Grow.
Yeah,
Miracle Grow, right?
The drug. What's the?
The drug for the plant.
There's a company that makes this special fertilizer, and it's everybody has to kind of buy it. I don't remember what it is. Whatever, I don't care.
Nitrate.
Sure.
I don't know. I'm not an agriculture connoisseur, if you will. I'm not a farmer. Yeah. But anyway, if you're a farmer and you're listening to this podcast, watch out for heart disease.
Yeah, All right, next up, New Jersey insurance moves. New Jersey Governor Murphy signed legislation on June 30th, creating the New Jersey Easy Enrollment Health Insurance Program. The bill makes it easier for residents to obtain health insurance through Get Covered New Jersey, the state's official health insurance marketplace. The department will work with the Departments of Human Services, Labor and Workforce Development, and the Treasury to implement the program with the goal of streamlining access to and increasing affordability of health insurance in the state. Through this program, uninsured and underinsured residents can indicate their interest in coverage for themselves or a household member on their tax return or through unemployment insurance benefit claims, which will be shared with the New Jersey Department of Banking and Insurance. That I think this includes every sort of department you could do, like partner with. It's like we've got human services, we got labor and workforce, treasury, Department of Banking and Insurance.
That's called bureaucracy.
It sure is. And, I mean, good for New Jersey. I think this is a cool thing. It's good to have a health insurance marketplace. Pretty sure there's one on the national level, but good to know that they're doing their own thing. Cool.
Yeah, cool. Good job, New Jersey. I still can't get over the fact that you get your gas pumped by somebody in New Jersey.
No, it's the craziest thing I've ever heard.
That is the most crazy. Yeah, that is.
That's somebody's job. That's somebody's job is to pump your gas.
But if you are a gas station attendant in New Jersey who is pumping gas, maybe you will be able to find health insurance faster with this initiative.
Right.
Now, since there's so many departments involved in the government, how long is this going to take? Probably like 10 years. So don't get your hopes up too soon. But if you're a current gas station attendee in New Jersey, and in 10 years from now you're a gas station attendee in New Jersey, and when this actually passes,
right?
Maybe it says sign legislation on June 30th, so maybe it will. Pass.
Maybe
it'll probably get filibustered. Who knows? Government's weird, man.
Yeah,
government's weird. I guess my point is signing legislation is one thing, but that doesn't mean that it's ready to rock yet.
Implementing it,
not ready for launch. Yeah.
Right. Let's see how it works in practice.
Next up, America's fittest city, Arlington, Virginia, has been named America's fittest city in the annual American Fitness Index rankings. Didn't know that was a thing. The rankings are published by the American College of Sports Medicine and Evolence Health Foundation. The index evaluated America's 100 largest cities using 34 evidence-based indicators. Rounding up the top 10 fittest cities are Madison, Wisconsin, Minneapolis, Minnesota, Washington, D.C., Seattle, Washington, Irvine, California, Portland, Oregon, St. Paul, Minnesota, Denver, Colorado, and Chicago, Illinois. Now in its 15th year, geez Louise, this has some history to it. The Fitness Index offers city leaders valuable research to make potentially life-changing decisions in policy systems and environmental change strategies that drive fitness and health improvements to their communities. Wow. Minnesota, though, I mean, it's cool that Virginia is the most fittest, but like Minnesota's on there twice. So I feel like Minnesota is cooler. I'm
also like, I would never have guessed that the fittest city in America would have been in the South. Like Arlington. to me, that just, all the other cities on this list are northern, western sort of places, but the South, man.
Yeah.
Interesting.
I don't know, man. It's Virginia, that's what it's known for.
Sure. Yeah, their fitness.
Yeah.
It's like Thomas Jefferson and fitness. That's it.
Yeah, that's the two things.
The two things.
Nothing else comes from Virginia except fitness.
Right. Thomas Jefferson.
Yeah, so if you live in one of those cities, congratulations. If you don't live in one of those cities, shame on you. Just kidding. It's not your fault. You can be fit and live in a state that isn't fit. It's a thing. And let's get to our next segment.
BREACH, Breach Patrol. It's a breach! All of the latest cybersecurity breaches.
Welcome to Breach Patrol. Talk about the latest breaches all across the world. Oh my God. Albert, what we got?
Breach feedback loop. While the Department of Health and Human Services Office of Civil Rights developed a breach notification process, it does not offer a way for covered entities to provide feedback on the breach reporting process. The OCR has agreed to implement a feedback mechanism by adding language and contact information to the confirmation email that healthcare entities receive. The OCR also plans to ask its regional offices to routinely review and respond to emails received in terms of the breach reporting process. The move comes after the Government Accountability Office recommended that HHS set up a feedback mechanism to enhance the effectiveness of its healthcare data breach reporting process. Hey, so now if you want to not just report a breach, but report about the breach report, you can do that.
They don't want feedback. That's what it comes down to. There's a reason why they didn't say that they don't provide feedback. Probably because they didn't want feedback.
Right.
That's usually the reason why.
Right. They're like,
Organizations
everything we're
don't
doing is
provide a way
right.
to give feedback. It's like, don't tell us. We know. Thank
Yeah.
you.
Yeah, that's
Thank
true.
you. Come again.
Yep.
Goodbye.
Bye. Yeah, for real.
So that's cool, I guess.
Yeah.
They're probably going to get negative feedback because organizations that have breaches aren't necessarily going to be the happiest people.
True.
And it's not. It's a negative process. It's not like,
It
oh,
is.
I'm going to go eat some food, which is a
Right.
positive experience. It's more like, I might get, or I've already gotten fined by the government, and I also have to report it again.
Right.
So,
Yeah,
oops.
it's not a party here, folks.
Look out, folks. Look out.
Folks. Look out.
Next up, law settlement for healthcare breach. Health Aid of Ohio is a full-service home medical equipment provider. And in February 19th of 2021, Health Aid discovered hackers had gained access to its network and viewed and removed files containing sensitive customer information. Files contain information such as social security numbers, dates of birth, medical diagnoses, and insurance information. Notifications were issued to the 141,000 plus affected individuals in May of 2021. A lawsuit alleged Health Aid had failed to implement reasonable cybersecurity measures to ensure the confidentiality of customer data. Under the terms of the settlement, any individual who was affected and had their social security number exposed is entitled to a cash payment of up to $250 and can submit a claim for out-of-pocket expenses, including credit monitoring costs and up to 4 hours of lost time at $15 per hour. Documentation must be submitted to support any claim. Any individual who can provide documentation that proves they were a victim of fraud can submit a claim of up to $2,500. Claims must be submitted by August 22nd, 2022, and the deadline for exclusion or objection is July 22nd, 2022.
Whoa.
That's a lot of information.
That's a lot.
This is a big headline. It's a class action lawsuit, which means, What does it mean, Albert? It means the lawyers get paid.
Right.
It makes a big headline. The company gets, pays a lot of money, and the people who were affected, not so much.
Yeah, they get a little bit.
It's like, hey, you lost your identity. Best I can do, $250.
Right, here you go.
And also,
Get yourself
your time, and you get yourself something nice.
Yep.
And then the time associated with, researching about it and buying credit monitoring services, we're going to limit that to 4 hours because that's a reasonable amount of time.
Sure.
And that value for that time that you spent, $15 an hour.
Right.
So it's kind of a slap in the face.
A little bit, but
yeah, but it's better than nothing, I guess.
I guess it's, better than nothing, but still.
Class action lawsuits are good to make a point.
They are.
And usually, it gets officials kind of riled up, but that's it. Yeah.
They're mostly symbolic.
If I was a lawyer, though, I would definitely try to get into the class action game because
I would.
That's a big paycheck.
Heck yeah, man.
If 141,000 people were affected and each of them get $250, do the math. That's a lot of money.
Right. And you could have one of those injuries, do washing dishes, and you could sue a dishwashing company and do class action.
Whoa.
You could get
Watch out, dishwashing companies.
I'm saying that's just a thing. We now know that there is a diagnosis code for it, so
watch out.
It's possible.
Maytag.
Yeah, see you later, Maytag. Going down. I'm gonna get $20 from you, and my lawyer's gonna get a ton.
For injuring myself on your
right.
And I have proof from a medical coding perspective.
Right. All right, last up, lawsuit overload. MCG Health, a Seattle-based medical data company, faces multiple lawsuits over a data breach that may have given cyber criminals access to the personal information of more than 1.1 million people. MCG Health is named in at least 8 recent lawsuits claiming social security numbers, medical codes, and other data were exposed in a breach that may have happened 2 years ago. The lawsuits, which also seek to represent the entire class of potential victims, accuse MCG Health of negligence and violation of Washington's Consumer Protection Act, among other complaints. The company is also accused of delaying notification of victims. As of yet, there have been no settlements made regarding the various lawsuits.
Dun, dun, dun. An entire class of potential victims, aka class action lawsuit, ladies and gentlemen. They're coming.
And we're back. It's back.
Honestly, I feel like in the terms of getting healthcare organizations to wrap up their cybersecurity a little bit and tie loose ends.
Yeah.
I think Yeah, I think it's a good thing because it's going to make them class action lawsuits are going to make them be like, oh snap, I don't want to lose billions of dollars to a class action lawsuit, so I better button things up.
Yeah. Well, that's cool. What?
Well, that's cool. And that's it for this week's wrap up of your weekly healthcare news. I'm Matt Moneypenny.
And I'm Albert Bettistelli.
And we'll see ya next week.
Bye.
Thank you for listening to the Bandage Podcast produced by eTactics.